Listening to your goals and dreams is our top priority at West Tennessee Bank. Benefit from our more than 100 years of experience and visit our Henderson branch today. West Tennessee Bank, focused on you. West Tennessee Bank is a division of Decatur County Bank, equal housing lender, member FDIC.
All right, there is a quorum present, so we're going to proceed with the meeting. Do I have a motion to approve the revised agenda?
Make the motion to approve. Second.
We have a motion to second to approve the revised agenda. Any other discussion? All in favor say aye.
Aye.
Okay, that is approved then, so we will go with the first thing on our agenda, which is the consent agenda.
Make the motion to approve. Second.
We have a motion to second to approve the consent agenda. Any other discussion? All in favor say aye.
Aye.
Opposed no, then that is approved. Next thing is delegations. I don't think we have anybody.
Nobody has contacted me for those.
And then we will go on to the next thing, which is our celebrations and spotlights. And I believe you have something on that.
Yeah, I wanted to give an opportunity for the board. I don't know if you had a chance, and I wish the technology was working with me, but it was working against me this evening. But I reached out to many of our staff, our educators who are from Henderson, been here for a number of years, or grew up here like I did, and asked them to provide that reassurance again to our families that schools are going to be a safe place to return to school. I know that there's a lot of information. I see the same thing that everybody else watches and listens to. I read and study just like you guys do, and to make sure that first and foremost we're concerned and priority with the well-being and the safety of our children and staff. Our children need to be back together, engaged with the learning opportunities that our teachers are preparing them for. It's a great opportunity for us to learn together. And what I reached out to these members of our staff to do is just reach out to your constituency, the ones that respect you. We all have our favorite teachers through the history of our school careers. We can probably name them off right now still today, and I'm 53. So I knew that these teachers who have made an impact on the lives of our students would be really key to ensure and reassure our families that we can go back to school. We can, once again, even though we're doing things totally different than what we've done before with how we're masking and how we're taking extra precautions with hygiene, with cleansing, with social distancing the best we can. And I just wanted to take the opportunity to say thank you. I've already thanked them personally, but I just want to read for everybody to know, if you've not had a chance to see those videos, they were shared through the Remind message board that over 2,000 get those messages each time we send out. And those were Renee Kroom, who is at the junior high as an English language arts teacher and social studies teacher. Mr. Jeff Haltom at the high school is a visual arts teacher. Coach Chad Hanna, who is an Eastchester PE teacher and football coach at the junior high. Ms. Becky Hartle, who is an elementary fine arts teacher and does a lot of those programs for our younger kids for the drama events. Again, the principal at the middle school, Tommy Kirk, that was the one I was going to show because his whole staff participated in his video. Ms. Ginger McPherson, who is our CTE director and also our high school health science education teacher. She was my first one to submit the video. Coach Wes Murphy, junior high, 8th grade history teacher and coach of basketball and volleyball. Ms. Haley Thomas at Jacks Creek Elementary School, a local resident and one of my former students. And then finally, Ms. Amy Woolley, Westchester's building principal. Those are the ones who responded to the call that I had. If you see them during the course of the time getting ready for school, I met with Ms. Woolley today again. I have met with Tommy yesterday. I just greatly appreciate these individuals who took the time out without any promise of any type of reimbursement or commitment beyond just saying thank you. And they stepped up to the plate and swung and struck out. And I'm really, or struck home. Not struck out. Thanks for the moral check. But I'm really pleased with what they have done. And again, it's not just these 8 or 9 who've chosen to represent this for me. I've had countless teachers, staff, give me words of encouragement through this process, because it's an ever-learning process. And I'm sure, as what we all have to realize, is that we're going to have to extend grace to everybody. We're going to do the best we can with the decisions we make as we are learning in the process. But I'm pretty sure everybody agrees that there's still a lot of learning yet to be determined. And we're just going to do it together, and we're going to do it well together. I have confidence that our teachers and staff are working hard. I know they are. But one thing that I know that these teachers echoed in the message is the importance and the missing of their children through this long break and entering into this school year. So again, hats off to our teachers. We've got some exceptional ones that we've always had, and that's where we can hang our hat and say we're one of the best schools in the state.
Anyone have any comments?
Is that video on the internet where we can?
I've got it saved in one of my Google files, but I can share all of those with you.
Sure.
Yeah, very good. Will do.
Okay, the next thing on the agenda is going to be a recommendation from TSBA for changes to our board policies. I think before we sit those out to everyone, you had a chance to look over any questions on those. All right, all in favor?
Second.
Okay, we have a motion second that we approve those changes to the policies. Any other discussion?
There was one, hold on just a second. Seemed like there was one that we had to fill in.
Yes, a blank, yeah. And I believe I left it out of my narrative. It'd be student concerns, 6305.
Yeah.
That's going to be, what my recommendation, based on what we've seen before, is 5 days, 5 school days.
That sounds good.
Is that, I mean, that was a recommendation from previous ones, and I was looking just for some consistency. That gives enough time for a principal who has to investigate and do a lot of other things along the way. It gives them time to investigate properly and make the right decisions.
All right, any other discussion? All right, can all in favor say aye? Aye. Opposed, no. Those are approved. The next thing on here is number 5, which okay, number 5 on here is a board acceptance of Tspa County schools as critical infrastructure.
Yes, sir.
And Troy, I'm going to let you discuss that. I believe you said Thomas is here to help with that.
Well, and again, as we have, as I have shared with you gentlemen, Thomas has done an exceptional job preparing our staff for what school year will look like post what we did in the spring. There were included with one of the board policies that you recommended, which was the Family First Corona Response Act, which provides extra days of paid sick leave that has already been, we didn't do that in the March or the April meeting because we had continued to pay our employees through the time of their break. So there's no need at that time to add that one to our policy. But now with how the response is and the possibility of having students or staff testing positive that could cause closures for certain portions of a school, we needed to, and the recommendation from the TSBA was to include that in our policy manual, which we did. Thank you. But now this part is, and I'll just give a little preface for Thomas, we are also in partnership with another organization called 5 Points that handles our brokerage of our health insurance and also handles our online distribution of our payroll. And they have with that a lot of content embedded in their online services through what's called a My Benefits channel, where they provide for our staff as part of our subscription or membership into their company, PD or professional development opportunities for our staff and other supporting things, which are now going to include even signing in the future. So staff can actually sign in on their phones when they arrive to school. So, you know, again, upticking the technology. This consideration for this board to accept this critical infrastructure in Chester County Schools came from a conversation and following literature from their resident attorney named Marissa Combs. She has, like what Thomas has, done a lot of reading and research over what legally the best stances are for employers and employees to make sure that there's plenty of protection and provision if in these cases where outbreaks or spreading has to mitigate back down to closures. And the effort here with this critical infrastructure is just for the board to recognize what's already been determined or identified. School districts, as you have seen from your language with the Department of Homeland Security, have already recognized that school systems, public schools, are critical infrastructures. So what I've asked Thomas to be here is to kind of add a little bit more to the narrative. These bulleted statements or phrases that she had included came from the language that she gave Marissa gave both Thomas and I when we read the content to consider adding this to the board meeting. So.
Thank you, Mr. Kilter, and I've got a little handout so you can kind of follow me there. While those are going around, I want to thank our board for the support you give our administration, the support you give our staff, and also the support that you give our community. It means so much to each and every one of us. So why would we want to declare Chester County Schools a critical infrastructure? And critical infrastructure deals with staff only. It does not deal with students in any way. But as Mr. Kilter said, to ensure the essential employees essential to operations to continue to work with as few of interruptions as possible. The Department of Homeland Security has authorized 16 agencies to qualify to be critical infrastructures. Government entities are one of those, and schools fall under the umbrella of government agencies. So pre-K through 12, higher learning education, the colleges, universities, tech schools, both public and private schools, all qualify to be a critical infrastructure. So what does a critical infrastructure assist in doing? Well, it focuses on the symptoms instead of the exposure. Just this summer alone, even before our staff has returned to school, our summer workers have given me 4 calls saying, hey, I've been around somebody with the virus, I've been exposed to somebody with the virus, or I've been in touch with somebody else that had the virus. What am I supposed to do? Well, first and foremost, let me say, if you are a staff member and you are sick, stay home. If you are a staff member and you are at school and you are sick or ill, please go home. If you have been advised by a physician that you need to self-quarantine for 14 days, then you will qualify under the Families First Coronavirus Relief Act, FFCRA, you will qualify for extra paid sick leave. If you are experiencing symptoms of the virus, meaning fever, shortness of breath, chills, upset stomach, and with the proper documentation you need to stay at home, then you will qualify for extra paid sick leave. So what is extra paid sick leave? Extra paid sick leave is up to 80 hours of sick leave, extra sick leave, in addition to an employee's regular sick leave that you can obtain if you have any one of 6 particular items listed by the FFCRA. And that's your second page right there. Those are the 6 different categories in which you can qualify for extra paid sick leave. Reason number 1, and this is what a critical infrastructure separates from the other items. Reason number 1 is that you have been exposed, you've been around somebody, but yet you don't have any of the symptoms, you're feeling fine. In all 4 of the calls that we previously had, the people said, hey, we're feeling fine, nothing's wrong. I mean, we're just operating as usual, so, we don't feel like we need to take off. So under a critical infrastructure, if you do not have any symptoms, if you have not been advised by a healthcare provider, then you would not earn extra paid sick leave, which are the 14 additional days. Now, if you have sick leave and you need to take sick leave, please, we encourage our employees, if they have that sick leave, they need to take sick leave, go ahead and take that sick leave, but yet you just would not qualify for the extra paid sick leave under the FFCRA. Why would a critical infrastructure benefit Chester County schools? It would lower our absentee rates among staff, and it would assist in keeping the day-to-day operations running as smoothly as possible. And one question I think that I've had, and maybe you've had too, will this affect the staff member's sick leave in any way? And the answer to that is no. Staff members can use any and all of their sick leave that they have when that's available. Now, believe me, there is much more information that I could probably give you. I've done a lot of research, a lot of reading, taken a lot of counsel, taken a lot of legal counsel. And again, this came from an attorney with our insurance company, 5 Points, who encouraged us to, declare ourselves a critical infrastructure. But let me just say right now, if you have any questions or concerns about the vote tonight, I would be happy to try to answer those questions for you.
If we had to close schools, students weren't there, are you saying the staff would come to work? Is that what you're saying?
Well, no, that's not what I'm saying. It's all about the symptoms of the virus. It's what the extra paid sick leave is all about. If you say, I've been around somebody that I heard they had the virus, or I heard they had been around the virus, or I've been exposed to somebody that's had the virus, then under reason number 1 of the FFCRA, you can go self-quarantine. If we declare it for 14 days, and you would receive your regular pay for that. If you are a critical infrastructure, and you have no symptoms of the virus, and we would document everything. We would have reports, we would have paperwork that you would have to file. But if you had no symptoms, you felt fine, then you would not qualify for that 80 hours of extra paid sick leave, just from self-quarantine because you was around somebody that was tested, you was around somebody that might have had the virus.
I understand that,
Okay,
but my
yes.
question is, we close schools,
Okay.
no students. We require our staff to come to work. Is that what we're saying?
Well, it's not addressed here, if I can speak, but we do have a policy that we applied and approved back in April that's telework during emergencies. It would come back on me to determine if we have an outbreak. Now, more than likely, an outbreak, that how we respond to it now would start with the smallest setting possible and then grow out from there. So it could be a simple classroom, one classroom, if you can identify who's had close contact. And again, close contact is somebody's confirmed with a COVID case. They go back 48 hours. They go back 48 hours from the first sign of symptoms and determine, this is what the health department does, determine with our efforts to support to find out who's been in close contact. 10 minutes continuous contact, or close contact could include hugging, other displays of public affection, drinking, eating, those things. Then those students specifically, or staff specifically, would be, if they're at school, they'll be exiting the building, contact your local physician, stay home, or follow the directions of the doctor, whether it means stay home and just stay self-quarantined, or come, let's get tested to be sure. In cases where, like for example, if a school gets shut down, where you may have a majority of your staff who's not infected at all, not involved at all. If the school is shut down where we have already set the school, just like what we had to do in the spring, we would support the telework, because unlike what we had to do in the spring this past school year, is where the legislator and the governor just said, the school year is over, there is no more accountability, there's no more testing, just count the year ended.
Right.
That's not what's going to happen anymore. They want us to respond in a more appropriate way, in a more consistent way, because it's necessary for our students to be educated. And the effort of the employees to provide that stability with that, it doesn't just shut down everything and just go on just a stopping mode.
Okay.
The infrastructure would be, if you have symptoms, you stay home. We're not trying to get people to come to work sick by any form or fashion. But what we're trying to do is be more mindful and more strategic to make sure that we just don't do a blanket like we did last March and April, and just because of the not knowing what to do, not knowing where the outcome is going to go, to cause everything just to shut down. You know, we've had some efforts to educate, but some of those efforts to educate was very short-lived because everybody knew it didn't count for anything. It was just providing some practice for some lessons or for some learning that they'd already had, just practice to keep the skills sharp. But that's not the way it's going to be here to start. We can't have a shutdown day 2 or week 2 or month 2. We've got to continue education. The telework would be if we have an emergency, and this can apply even with an inclement weather day. We can still have school then. So there's positives that's come out of this COVID. It's forced us to do things that we haven't thought about in the past to do. It's taken a whole lot of work to consider these options, but it's going to end up being fruit for us in the years to come as we face these, whether it's a natural disaster, tornado, something that hits and keeps us out of our buildings, we can still operate and have school and staff still work.
One question.
Mr. Thomas, do we want a motion on this?
Based on what Ms. Combs said, we would need to have some motion from the minutes that reflects that you recognize what's already been established by the Department of Homeland Security, that Chester County High School specifically would be considered a critical infrastructure.
Is it just the high school?
No, I'm sorry.
K through 12.
Forgive me.
K through 12.
Thanks, Mark, for keeping me in check, because, no, I didn't mean that for high school. I was that language so many years, I forget.
I'll second the motion.
Right, we have a motion, a second, that we accept Chester County as a critical infrastructure, and that's from K through 12.
Yes.
Any other discussion?
Doesn't it include pre-K?
Pre-K. We have the pre-K.
Okay, I'm sorry.
Yeah, pre-K.
Pre-K. All right, pre-K to 12. Any other discussion? All in favor say aye.
Aye.
That is approved. Okay, we have staffing additions and changes. Troy sent out a copy of those. I hope y'all had a chance to look over it. There's several new hires, resignations, reassignments. Do you want to cover any of that, or does anybody have any questions?
I will say this for the new hires. We knew at the turn of this first semester to the second that we were going to have an additional teacher at East Chester. That additional teacher was needed because the student counts was reaching that number, that with the expectation of what kindergarten registration has been in the last few years, then an additional teacher at East Chester that can help balance out the student or the teacher counts per grade would help. Sandy Thompson is the one who was hired by Ms. Scott and Ms. Thomas. Sandy had worked previously in that school as an effective parapro. She has a teaching license, and her kids have gone through the school system, and it's a good family, it's a good hire. Then Melissa Gray as a new hire was replacement to Kaylee Reeves, who left Jacks Creek Elementary as a second grade teacher. And then Jay Johnson was a hire at the high school because of the resignation of Hannah Watson. Hannah Watson-Treese, she was a young lady that's from McNary, wanted to return to McNary, go home and hopefully find a job. Well, the job came back to us because the one from McNary Central applied for the job that was open for her, and we hired him. He was actually interviewed last year for that same job. Hannah only worked for us 1 year, and he had been the first pick over Hannah, but because of the salary amount that he was not satisfied with, he was doing better just to stay at McNary. But because of the work that you guys did when you passed the budget and the comparable step and level that we have now, that recruited him to come back and accept the job this time. And then some of the other positions are just shifts for the reassignments and the resignations. Some of those you already know, and we have communicated to that at the past events. I hadn't talked to my brother Ricky Catlett lately, but I know he's working. I see him on TV.
Anybody replacing some more yet?
We've got the application request open. We've had some applicants that have applied. I know of one in particular that did not satisfy the qualifications. I know of another one that may have satisfied, but she then decided to not entertain the position or consider it for an interview. I believe, is there another one still?
There has been, but we've also reached out to other entities, local businesses in that particular field, and also to local colleges to see if they might have, candidates might be interested.
And we actually have one.
We contacted two we're going to meet with on Monday.
Okay.
From Jackson State.
Have they turned in their application?
They're in the process. They're going to do that before Monday.
We have one on high school staff that has the credentials that may allow her to do it, but the decision is going to be made from doctor, listen to me, from Clay.
Dr. Burley?
He's quickly becoming a doctor at public school, high school, but whether or not that she's where she can be the better served.
Anybody have any more questions, comments?
I'd just like to congratulate everybody on that retention rate. I mean, that's impressive to me. I've only been here a short time, a little over a year now, but out of the number of employees and to keep that many, I think that says a lot for the district.
Well, especially with last year, we hired, 26?
We did, certified teachers. That's just teachers.
That was just certified teachers last year. Now we're doing 4. So it speaks to them that they're, I think, satisfied where they are. I can tell you they're satisfied with the work of many of our district staff to support their cause. And that stability there really helps our educational plan as students are more familiar with the people that's leading the classroom instruction.
Yes. All right, that covers our staffing change. The next thing is a reflection of the superintendent evaluation. I think Troy included some on that. I will say, and I've always said in the past, the evaluation is like anything else, it's a learning tool. And we hope that Troy takes that, looks at, what the board's opinions are, and then says, okay, this is where I need to work on myself, my improvement. We're all can improve, and I'm sure Troy would like to say something about the scores. They are up for the year.
Right. I'm making steady gains.
That's as long as we're going up.
As long as we're going up, we're all is well. Again, I would say one thing that was, and I know it was one of the 2 points, but it was shocking to me of the number of communications that have gone out through Remind Message. I don't know if you paid attention to that, but during the school year, this is not just for me, by the way, this is including me, but the high school staff, junior high staff, all the staff, and all the schools who use Remind on a routine basis to communicate to their kids, especially during our break. I know they use Remind as one of their tools to stay in contact with the students. But we had 26 million messages sent out, over 26 million. And that is tremendous when you have a staff, teaching staff of roughly 218, roughly. With that many staff, and then students around 2,800, that 2.5 million, 2.6 million messages go out. And that message board has been really good because it does allow that opportunity for feedback. And it's not just a one-way message only. It has been a useful tool in our efforts to communicate frequently with our community and will continue to be used.
Well, I'd just like to say that I thank Troy for the job he's done. This last year is completely uncharted waters. Nobody knows. I've told him before, sometimes coming down from the state, they tell him one thing today and 2 days later, well, no, we're not going to do that, we're going to do something different. But I think he's trying to stay on top of it. And I appreciate his efforts. Any other comments? All right, then we will go to our adjustment for student and staff dress code policies, and that's just come about, so Troy, I'm going to let you address that, please.
Okay, again, I have received, and I do appreciate, make sure everybody knows, I do read the emails that I receive for people that ask questions about what's the next steps in the process of reopening schools. I try to do my best to respond in a timely time, but it's not the only thing, unfortunately, that I have time to do. So I'm working on a frequently asked question document so everybody can be exposed to the same questions and you can see what the responses have been. Again, and I would say, echoing for all cases, that everything we do is going to be done with guidance and support and alignment with what our state, national, and local health department officials are telling us. We're not going to be jumping out there saying things, doing things contrary to what others who are in that field of expertise are giving us guidance for.
Discussing this, correct?
No, not yet. But I did have,
Okay, I just,
I'm sorry, that was too much of an intro. But I did have a couple of students.
I thought we was going somewhere else.
Well, I had a couple of students who asked for dress code changes. I'll just leave it like that. They didn't get into much of the details of what they wanted to change, but for the two schools that were reflected, because again, the high school students who asked were because of their requirements to wear masks. So with that being said, and again, I'll say this, wearing a mask is not a measure of trying to add something to a dress code. It is just a safety measure. There is nothing with it requiring a mask that now is going to be representative of a better dress look. I can tell you without any reservation that when they tell us that we can take our masks off, I'm burning mine. I'm done with it. But for the safety of our students and the fact that we cannot cause our buildings to get bigger in every way so that we can afford safe distancing for all students at all times, same thing for our staff, we have to use this preventative precautionary measure to make it work. The students, however, asking, since we're having to do this, can we do something less rigid with the dress code? And I asked Mr. Murley and I asked Dr. Anderson, and collectively they had requested what is included here is ask that the students have an opportunity, and it's not a change in the dress code because they have the authority within that to adjust the dress code on, as it says, on rare occasions. You know, like when they have a dress down day for, say, a pep rally or a dress down day because of homecoming, they can do those things, but it does say on rare occasions. So what I'm asking the board to consider is making a change to where the dress code adjustments can be made at their discretion, not just on rare occasions. And they're wanting to do just an untuck of a shirt and no belts during this time.
I've had several people call that's have smaller kids. You can't try on clothes at stores right now. And they said, could we not relax dress codes even for the other kids? Because, I mean, you can't try clothes on, it's hard to...
I don't know anything about that.
Well, I mean, all the dressing rooms are closed in all stores.
and and I saw something where it said that people were having trouble with tickets. They didn't want to let them bring it back if it doesn't.
If you carry it home, it's yours.
So,
And that's the reason I thought we might want to relax the dress code, say the first till Christmas. Or, you know, in some form, you know, for the smaller kids.
basically, we're saying not have uniforms, right?
Well, we don't have uniforms. It's more restrictive.
Dress code. I mean, dress code. But, I mean, I had several phone calls about that. You know, it's hard to buy clothes for kids when you can't try them on. That's a good point. And if you do buy them, they're yours. They're yours, whether they fit or not.
Mr. Burley, you have any input on that?
You got small shop.
He has a lot of input.
It affects you more than it does anybody.
I know.
Well, I think what he's asking is for principal discretion. I think, you know, I know anytime a student comes to us for concerns on, you know, just an example, when they break a leg and have to wear a cast, they ask for exceptions for that. So I think that could be an exception to administrator in the building could make for kids that their pants don't fit or whatever your suggestion. So as we're going to be allowed, if this gets approved, to relax the tucking of the shirt and the belt, I think the elementary and the middle school principals could.
Well, it need to go out on their mind or something, though, because these parents now are trying to figure out what kind of
Well,
clothes.
it doesn't need to be a single principal, but it needs to be consistent.
It needs to be consistent, district-wide.
Okay, and so,
Well, with the relaxing of the tucking of the shirt, well, the K through 3, it wouldn't affect them.
K-5. Well, yeah.
It'd just be the middle school is really what we're talking about, the 4th and the 5th grade. Because K through 3 doesn't have
They don't have a dress
they don't
code.
have a dress code. So it'd just be grades 4 and 5, so
Yeah.
with untucking of the shirt, not wearing a belt, satisfied that need, I don't know.
I mean, that wouldn't help on buying the right size.
Maybe blue jeans.
Well, and again, I was a part of the administrative team with Pickens when we went to what we're doing now. It takes a whole lot more time than just a discussion for the next 5 or 10 minutes and then making a motion to approve it. I would ask if you could give us a little latitude, since we're not going to have another board meeting before school opens, that if we could have a chance for all the principals, that'd be Tommy Kirk at the middle, Belinda, and Clay here, to let us revisit. So based on what you're saying, the board's choice would be to
relax it.
Relax, you know.
You know, at least till Christmas or hopefully, you know.
Well, I can say this, and Clay, I think he would amen this. It's going to be hard to, once you relax, to ever tighten back up. I know that's, amen.
Amen.
So, what we're deciding here, and again, I hope that these masks don't last to Christmas. I pray they
Oh, I
don't.
do too.
So what we're actually deciding here, for if the board is willing to give us a chance to bring before the board, before school gets started, here's what our plan is. I'll send it to you guys, but if you trust us to do it, we'll make sure that there's something that addresses all the grade levels that do have to adjust it. That would be 4th, 5th, 6th, 7th, and 8th, and then all through the high school.
one of the concerns that I've received is like if parent buys the clothes and then we go back for 2 months and then we're out again, then the kid may outgrow the clothes, it's a.
I got a daughter like that.
Okay, well, but what they were saying is, I guess, Shane, you saw this letter, I sent it to everybody.
Yeah,
Okay.
all right.
But I'm just wondering, how much more time the parents are going to have to, they feel like they've either got to buy the clothes or not, but you know what I'm saying, the time's running out for a decision to be made.
I agree. Yeah, I was not prepared for us to, we'll do what we have to do. But, there's a whole lot more to it, because I can say that if it was to go back as it was before, I don't know if you guys remember, but it's vivid on me and probably Coach Murley, we were having to deal a whole lot with some rebel flags and the fussing points of the Dixie Outfitters who were saying, you can't tell me I can't wear that on my shirt.
Well, and I'm not saying we're gonna go back to that.
Well, that's what I'm saying. We have to take our steps cautiously to make sure that we're not doing anything that offends, what offended us 20 years ago may not be the same offenses now, I just don't want to rush into something that they're not going to be satisfied with. It's going to be more of a issue with, because we had sagging pants a lot, we had issues with holes in pants. There's some things that can truly occupy your full day, doing nothing more than inspecting, and then having to deal with it discipline-wise. I'm not opposed to it, I'm just saying it takes more effort than just a 5-minute or 10-minute conversation.
It's something we need to look at though, because I've had several calls about it.
Would it be sufficient to just relax it to the point that it gives the building principal the discretion to make the decision on a case-by-case basis?
I don't think so.
But
There needs to be some consistency across.
I get that, but if we do that tonight and then y'all meet, right, y'all develop some plan to be consistent, right, and that way we can kind of move forward on it.
I'm fine.
That's basically what we're gonna do anyway. Y'all gonna put a plan together, then we're gonna approve it.
Yeah. At that time, their discretion was, untucking shirts and not requiring belts, which, as of late, has been the more consistent issue. But, we can do that. We're just gonna make sure that Tommy, Belinda, and Clay and I have an opportunity to be consistent with what we're doing.
Would that streamline it if we go ahead and take some action on it tonight, as far as just giving the building principals discretion?
I would say if you give them that discretion, that could, and then what that means is whatever we come up with, you're trusting us to run with it. If that's what, I agree.
All right, well, I'll make a motion then that we just relax the dress code.
So,
Well,
I'm sorry.
yeah, I formed my own question there. We want to do it for this school year?
No, I'd
First
say it's
semester?
first semester.
First semester, okay. We relax the dress code for the first semester to allow building principals the discretion to determine what's appropriate and what's not.
Or would that alteration be relaxed until the masks are no longer required?
I would lean back on the guys and the girls who are having to enforce it. Not,
Well, that's the reason we're even addressing it.
That's right, that's why it came up, and for discussion, why I included it.
They can't get the dressing room.
Well, that's true too.
We can revisit it after that first
Yeah,
semester.
after the first
The mask may
semester.
come and go.
I hope it's gone next week.
I hope they do too.
You second?
Yes, sir.
Okay, we have a motion and a second that we're gonna let the building principals decide on the dress code
At their discretion.
at their discretion for the first semester.
And put something out on their mind as soon as.
Yes, sir, as soon as we get there, that'll be easy to do.
Okay, anything else in the discussion? All in favor say aye.
Aye.
Opposed, no, then we will approve that. And then did you want to talk about the teacher?
Yes, I would. If anybody's got any question about the teacher, it came about relaxing the teacher dress code. I was not in favor of it first until I heard the justification to allow, because we do have some of our staff that are able to wear scrubs. Custodians wear scrubs, by the way, but also our health science ed teachers wear scrubs like they would reporting to a clinical experience. The scrubs in what they're recommending, as what you see read or available in your agenda, is when they take their clothes off from school, just like a first responder in a hospital, you need to launder those clothes on a daily basis. And in that laundering process, if they're wearing clothes that are meeting their current dress code for the teachers, being business casual, then it could be sports jackets, slacks that are dry clean only. So giving them some latitude to say, and again, we are not planning to purchase scrubs for everybody. We're just using that as an example of what Johnny shared with us. But to give them at all grade levels, this would be with all schools, to have that option of having a type of clothing that can be laundered daily and to lighten or lessen their restrictions.
And do that for the first semester.
We can do the same thing.
Make a motion. Relax the dress code. Staff.
Probably have a motion second, we relax the dress code for the staff and the discussion. All in favor say aye.
Aye.
Opposed, no, then that is approved. Okay, and then we will be going down to the number 9, which is school reopening.
Well, I'm just going to ask you, board members, you received the same message that the community stakeholders received. I have tried to keep you in the conversation loop. I answered another email this afternoon with a little bit more detail because that's what they were asking for. And I actually sent that out to all district educators and staff because I know that not only are the families of students asking, but their staff are asking too. But I'm just, again, here to respond to any questions that you may have about plans or efforts that we will have and exercise to make sure that we're not adding to the spread or the risk of community spread.
Okay, I've had some questions that were put to me that, now, I think it was addressed in that that you sent out later this afternoon about if a teacher is sick, or all the, with the students in her classroom be quarantined, or like if you had a sub who taught, which, you know, a lot of them work every day, but it's at a different spot every day. If they wind up with something like that, then what about the number of people they have contacted? And then the buses.
Well, to answer your questions, and I got this information yesterday from a lady who is over our Chester County Health Department, Emily Rushing.
Yeah.
Emily shared with me after a conference call where all superintendents were able to participate and have people in the health department at the state level, and including Kevin Morris, who's a local guy, but he's our regional epidemiologist, participated in that in an attempt. And again, the thing we're looking at, there's certain protocols that will be followed each day, but it is not a condition that has a cookie cutter model for every case, such as if you have, I'll just play the last one you did, let's say that you have a substitute. Well, in all cases, let me back up and say this, and in all cases, whether it's student, substitute, support staff, or teachers, or even principals, every day they need to make a commitment to screen themselves. They need to go through that self-monitoring, find out, do I have a temperature? Am I, just like what Thomas read off, am I having shortness of breath? Is there a cough, or lingering cough, or issues to where I have stomach problems, I think is how you described it. You know, if any of those circumstances are occurring, we direct based by what the State Department and the local health department say. Stay home. If you're already at school and those things are discovered, and again, the temperature is only at 100, not 104, as some people thought. It's 100.4, but it's only 100. If it's at 100, Kevin Morris said it, of the 400 plus that he's interviewed of cases, they had a low-grade fever of the majority of the ones he interviewed. And he said the majority of them had sinus-type infection. It was not a full-blown pneumonia setting. The majority of them are almost what they call asymptomatic. But if you have any of those, and everybody will be expected every day to self-monitor, it's going to be a part of our natural, normal routine, as I've shared to some families. As you make sure your sons or daughters brush their teeth before they leave for school, you're also going to make sure that their temperature is checked and that you go through a series of the questions that everybody has had to experience. And if they have any of those where they can't mark no, stay home. Stay home, contact your local physician to get further guidance, whether they say just quarantine yourself or whether they say come to the office and get tested. If somebody, and again this is from the health department, if somebody is positive, that's different than somebody having symptoms. If they are confirmed positive, the health department says that if it happens on a Wednesday, then when they first recognize symptoms, the person who is positive, they back up 48 hours. So in a 48-hour window from when the symptoms first are realized, and the health department will work with us and attempt to reach all the people who have had that close contact. So let me just say this. It is imperative, and again, parents who are in the room, it helps us to do these things. Teachers are going to have seating arrangements. Have to. Busing is going to have busing seating arrangements. Have to. Because the truth of it is, Stephen Maurice, who's sitting in the back of the room, if that's the distance that he and I have, and I'm tested positive, Stephen is not considered in close contact with me, and he's not going to be somebody who would need to be quarantined. It would be Bob and Sarah, possibly Mark. So that's where the health department has told us that it's not going to be this, all the district shuts down.
Right.
They're starting first with, even at the smallest, that could be parts of a class or setting, could be a sports team, depends on where it falls. But it starts first with a confirmed case. They back up 48 hours from when the symptoms first realized, and through the health department's work with us for us to help them, they contact trace all of those people, and then they go through the process of self-quarantine, contact your physician, follow their guidance, and again, for 14 days.
Well, now, are they still planning to have some of the like at lunch to have the class?
Yes, sir. Thank you for bringing that up. Yeah, we're in those places, and again, in the classrooms, that's why we're requiring masks at the higher grades, because there's transition where you have a lot of kids in the hallway at a single time. I know I've talked to building principals at the lower grades, and they're doing things a little bit different to diminish the number of times that a lot of kids are going to have to be in the hallways at the same time. In fact, in one school in particular, the teachers are going to rotate, the students are going to stay put. But now, in the lunch shifts, I know that everyone that I've talked to, they've got a cafeteria plan. I had talked, Clay and I are going to talk tomorrow. But everybody thus far has got a cafeteria plan where in some cases, they have half the kids staying in the classroom, having lunches brought to them.
Right.
And then the other half go to the cafeteria where there's more room to space out with 6 feet. Assigned seating in the cafeteria. Because again, if you have somebody who is confirmed case, the health department, just like in some cases, just the general person doesn't know who that person is. So it's important to know the names of the child, who are the children who are within that close proximity. And again, it's a 10-minute window. So if you're passing by somebody with the COVID, it's not necessarily considered a close contact. You have to be, and this is their guidance, this is what they told me, 10 minutes in close contact, and 10 continuously.
Well, the kids that are in the classroom, who monitors them?
In what way,
During the
Dr. J?
lunchtime.
The teacher of record. I know that and that's something that we're going to have to request a waiver for. Those were a series of waivers, and that's one waiver that we're going to request
Like the duty-free.
for the duty-free lunch. Yeah, because of, and again, this is not going to be a permanent fixture that they've lost that privilege.
Hopefully this is going to be a short-lived deal, I hope.
Me too.
But I mean, there's so many, a lot of this stuff, but it's like the masks. The mask does me no good. It keeps me from spreading anything if I've got it, but it doesn't protect me. If nobody else had one on, it would be useless to me. But it would protect them though.
It does offer, everybody's heard the term mitigate. Mitigate's been something we say now all the time, like it's a daily word that we use. Mitigate does not mean it corrects or fixes, it just means it just lessens.
Kind of makes it a little
less likely, right?
May I ask a question?
Let me understand something real quick, you can. We were talking about the teacher test positive. Did I hear you say 10 minutes is what the CDC says?
The CDC and close
Close
contact.
contact.
It has,
Therefore, the whole class would not.
it may or may not be. It just depends on how much that teacher moves in the room. Again, I would hope, and I know, because they're very conscientious, that our teachers and our staff are going to be very serious about their self-monitoring.
Well, they're concerned for themselves also.
Exactly.
I mean, that's.
And if you look at the data, in the state level, our children are not the ones most at risk. It's our older adults.
Right.
And that includes some of our staff who are older. So we're not only wanting to make sure our safety precautions benefit our kids, we're not worried, but we're very conscientious of our adults too.
Yes, ma'am.
Since you're not requiring the younger kids to wear a mask, is there an option for that? Because
Yes.
I have 3 kids that are in the elementary school, and just like you said, the mask is not protecting my kids from catching it, it's protecting them from not spreading it. So because I'm responsible and I send my kids to school with a mask, but not everyone will, can that be a mandated also part of?
Well, the guidance that we've gotten from the CDC and others, that anybody 12 and younger are not required. Now, again, I'm not a medical expert, that's why I lean upon those who tell me. We're encouraging those to wear a mask. And again, in the case where if it's just you and I in the room, I'd be bringing my mask down because I can tell what 6 feet is. But again, the children can't. So there's going to be a lot of responsibility, and I'm very blessed with the teachers that we have at the lower grades, because I can tell you math, reading, social studies, and science are not the first things we're going to be teaching. We're going to be making sure our kids understand what good hygiene is. Everybody is going to be participating. It's not a custodial job only to make sure your rooms are clean and disinfected. Everybody's going to take an active role, because it's easier for everybody to do a little bit than just a few to do a whole lot. But now on the low end, all the recommendations that I have read and received does not require those low grades. So that's why we made it as a encourage. Now on the bus, I strongly encourage. I think that it would be best served for everybody to have a mask on the bus. But here's not what we're going to do. We're not going to have bus drivers that denies a child to get on the bus because they don't have a mask. We're not going to do that. And just like in some cases, we've had some to ask, is this going to be a dress code violation? It's not. We're going to encourage, even for those who are mandated, we're going to mandate them because they know the layout of the school. If you have not been in the hallways of Chester County High School when the bell rings, brothers and sisters, there's no way to social distance. So you've got to have some level of protection being recognized and honored by all. And I'm trusting that by the modeling of our adults and by the actions of many of our upperclassmen to support the learning for our younger classmen, that people are going to participate. I'll give you one example. We have one of our teachers at East Chester who had a heart transplant, kindergarten teacher. Those babies were asked to wear masks, and all 5-year-olds chose to wear them consistently. So I know that they can do it. I know some parents have said, my kid will keep it on, and look at me, I'm bringing it down too because it's hot, my contacts are fogging up.
And then I have a second question. 4 weeks ago, we were roughly around 14 cases in Chester County. As of today at 2 o'clock, we're at 99. Is there a possibility that we could delay starting, even if it's 14 days or 30 days, just to kind of let it settle down? Because going 7 times, 14 times 7 would be 98 is more than...
Well, I check the numbers daily.
A lot.
And the numbers have gone up, like you said, it was 91 yesterday.
It's 99 today, yeah.
But that's all cases. Do you know how many active are included?
No, I didn't look at that.
We
But
had
it's
12 before this started ticking up.
Correct.
It's a steady update every day. It goes against what the World Health Organization, CDC, Fauci, all of them says you have to have a 14-day decline before they recommend opening your school. And we have a steady increase. That's wrong.
That's just, I think, a lot of our concerns.
Well, let me just say, for the children, it's 7. As of yesterday, there were 7 in the age group of 0 to 10 who had tested positive from start to finish. And there were 7 in the age group of 11 to 20 from start to finish. That's not active. That was just 14 total. In the state of Tennessee, including Memphis, Shelby County, Davidson County, Nashville area, the number of kids in the 0 to 10 age group as of yesterday who have tested positive with the COVID is 0.045%. That means that 99.95% of kids in those age groups, the 0 to 10 age group, tested negative. Our children are our concern. Our concern is also for our adults. But there is not again, when you say the 99, and when you look at the state level, like yesterday, it was like 67,000, something like that number. Actually, active cases in the state is 27,000. It doesn't sell as many ads, and it doesn't carry as much newsworthiness. Doesn't diminish those 27,000, but see, we're figuring all the kids from day one, all the adults from day one to the present. And if you don't dig a little bit deeper, it's very difficult to make conscientious decisions based on the data, just looking at the overall number only.
But if we use that number, then it's per capita. Tennessee is one of the highest states because we are such a smaller population per capita. So I understand entirely what you're saying, that the risk of spreading it amongst children is very low. However, I live with my elderly mother who's a high risk by itself. And I'm struggling because I'm a single mom and I work from home. So do I have to now homeschool all 3 of my children because I don't want them to catch the virus and kill off my mother? Or heaven forbid something else happen, you know? Or do I send her to school and hope that just because we wear a mask that everyone else will? I understand what the CDC guidelines are, and I understand that it's a very difficult decision for everyone involved. I just wish so that you can more so mandate that we either have a virtual option to learn, or that mandate that everyone has to wear a mask to school.
The virtual option is a work in progress. It's not something that we have now because it's more than just having sufficient number of devices, which we do. We have sufficient devices that every child in our school district can be handed a Chromebook today that is either brand new or new within 2 to 3 years. The internet connectivity in the county is a concern.
Right.
And again, Mr. Ben here that works with Southwest Tennessee Electric has purchased, as not being himself, but the company has purchased Aeneas. And Aeneas that I have met with, the executive director of Aeneas, and also with the representative from Southwest that is involved with the internet connectivity of fiber for all membership. It will be available in 3 to 5 years. Now, that's still too long to wait. We're working toward having that opportunity as an option, and our target audience would be the ones, for medical reasons, can justify having a homebound or a online service through homebound services. If you have not, and I'm asking everybody, Mr. Maurice in the back of the room generated a internet connectivity survey. If you have not completed that survey, we really need that information, because with that we glean if a student, because of some requirement with the CDC or medical doctor that says you need to stay home for 14 days, if they are asymptomatic, then that child can continue their education in the very thing that you're asking for. We just don't have the comprehensive awareness of our staff prepared to deliver online instruction. It is much different than what happens face-to-face in the classroom. And I can only imagine what my other friends in other districts are really having to deliberate and decide on, because we all want to do what's best for our kids, and nobody wants to do it to try to harm anybody. But to say that we're going to offer online to all, we don't have the capabilities at this time to do so. I wish we could. And again, in short time, and again, I know from talking to the people with Southwest and Aeneas, there's a large swath of Jacks Creek community that maybe by Christmas time are going to have the opportunity. It will eventually get to everybody, including me. But I can tell you in my home, I've got DSL. It's the best that I have to offer. It drops me every day. To say to a child or children that you've got to get online and spend 6.5 hours every day on the computer, in my case, I'm going to be off as much as I'm going to be on. So there's a whole lot more to just having the hardware. We got it. And actually, we have invested so well in our devices and our internet, but all of those investments have been when kids are in school. We have a system with internet connectivity that in our schools we have as good or better than even Freed-Hardeman has on their campus, because we have purposed the dollars for it. And in multiple grade levels every day, students at all grade levels are taking devices and using them as an integral tool in their instruction. What breaks us is what happened in the March when they said your doors have got to be shut, kids can't come in. We're also going to invest in boosting our internet signal out to the parking lots, to the high school. We're going to also do it at Jacks Creek Elementary, and we're going to do it at Westchester. We're taking our 2 most remote locations and also our high school location that will allow an internet connection signal from in the building to go all the way through the parking lot. Because here is what some of my friends in other districts have said. What if you have somebody who does not have internet at home, and you're requiring them to use the internet to get their instruction? And my friend, who is a very educated person, said they can go into McDonald's parking lot and tap on their Wi-Fi. To say that to a mama or a daddy who's got multiple kids, that we're going to sit in the car outside of McDonald's and get on the internet, or, the library, I know I've seen them, and I've seen some try to tag in with hours. But we have limited parking space. We're trying to accommodate the best we can with what we have. And we're also investing in hotspots. But even with hotspots that we are investing in, there's places in our county that have no cell phone signal. So giving them a hotspot's like giving them a paper clip. Really, it's just a piece of hardware without any connection. What we are going to do is we're going to offer the best instruction we can. More than just the CDC, but the American Academy of Pediatrics came out the end of June saying that schools need to be back in session. Now again, judge it for what it is. I've seen, because even on both sides of the aisle, conservative and liberals, I've seen both sides say somewhat the same thing, that it is important for our kids, for the social needs of our children. We've had some that's been in the school, or been in their homes since March, and visiting homes who have no access because of no transportation. They lean upon us for not only their basic needs to be supported, but definitely their social needs. I mean, that's going to be where our teachers and our staff and our leaders are going to be most conscientious first. The math, the reading, the language arts, all the other content is going to come. But we got to get these children realizing that we care for them, we're going to meet their social needs first, and then the others will come.
Going back to what you said about the classrooms and the parents making sure that their kids, check their temperatures and all that. We got parents that don't even brush their kids' teeth in the morning. So how are we going to make sure that they're making sure that their kids' temperatures are done?
Let them come and stay with somebody notice.
Yeah.
Kids are already. I think it was just every day.
Well,
Because that is a big concern.
I can, and it's a good question, and I wished I could say that I could just snap my finger and everything is best, but here's what we can do to help that. Tspa, who is, and we're in our own purpose dollars, we have purchased, and Tspa, the Tennessee Emergency Management System or Agency, has given us somewhere in the neighborhood of 60 to 70 thermometers that the schools will have. What we expect is that the lower grade kids in the elementaries and the middle school, those teachers need to have more access to and these are the remote thermometers, thermometers that you see. So they'll be able to check. And just like most parents, when you start to see children who are lethargic, you start to see that they're running down, it'd be easy enough to get that thermometer or their temperature checked. And then we go through the process there to make sure that if a child is sick, we isolate them. We ensure that that's not a false read, because sometimes kids just stand out in the sun or do a PE, and guess what? Their temperature goes up. So we make sure that it's a legitimate read and not a false read. But when we know that it's a true read, we've already isolated them, then we're going to contact the parents. We're going to say, hey, by the way, your child had a first read of a 99. We've got them isolated. We're going to go back and check in about 5 minutes. Somebody else is going to check. It's going to be either a school nurse, if there's one there available, or another staff, not the same person. And if the second person gets a similar read, contacting the parents, keeping the child isolated, encouraging them to do what we've already said. Stay home, contact your physician, follow their guidance. And then if it leads to something more significant with more symptoms, of course, again, we've got to remember there's other sicknesses that we've had to deal with through the years. Strep, you remember the flu last year? I mean, all these things, they haven't gone away. We're just going to be very cautious. I can tell you, unlike last year when we took one day off for the flu epidemic, you remember when we did that last year? Nobody asked me to social distance the kids on the bus. We put them right back on the bus, sent them home for the day. We did the best we could for the information that we had at the time. And that's what we're doing every day. And I would love to say that all the information that we learned back, well, from the start is going to be consistent with what we're going to learn tomorrow. But just like what one of the board members said, things are changing all the time. People are telling you different things. And you got to trust the people who are telling you these things have the expertise to give you that advice that we need to follow. So we're going to take the experts, ask them where the data is, and then from that data source, then we're going to make the best assessment of how to protect our kids, how to protect our adults, to make sure we can continue to have school. I'm telling you, we're going to do wonderful. I know that there's going to be hiccups along the road. I just pray that you and I both show each other the grace to know that, look, I lay down my life for the kids. And I know I'm sending 2 of my 3. One just graduated. So I'm sending 2 of my 3. I got an investment in it too. I don't want my kids sick. But I trust the people who are over those schools are going to take care of my kids. And that's important.
I have a question. My son is autistic, and they have SP at Eastchester, and
They have what at Eastchester?
They have the class called SP at Eastchester, and my son is autistic. And some of those children do not understand what's really going on, and my son is one of those kids. He takes his mask off. He doesn't pay. He does not get. How can you make me feel any better about him going to a classroom with little Johnny over here who has a snotty nose at the front of the door, and he has to come back, or his fever is not as high, so he can go on to classroom. I go to Eastchester. All my kids been there. And Chester County does have great schools. They really are. There's no denying that. Our schools are wonderful. I tell anybody to bring their kids to Square.
Thank you.
But at this moment in time, I don't believe the kids are scared. My kids are terrified. My 6th grade don't want to go to 6th grade. That's a new school.
Yeah.
Can we just not find another way to just relax school a little bit? And if you do have internet access, let those people who do have internet access, let them have another option if they can. Versus, I have internet, she doesn't have internet. Let her child have that spot so they can practice social distance, they can still be healthy, and my babies can stay at home, or whoever children it may be.
Well, I can tell you put some time and thought into your question, and again, I can tell you this, with children at Eastchester, I've had my conversation with Kim Scott yesterday. Very heightened awareness of the needs for all of our staff and students to do right. And I'm saying do right, like you mentioned, somebody having a slight fever and going back to school class.
They give a Motrin, they give their child Motrin.
No, they won't give a Motrin at school. Now, those things will be, again, we're comparing to things that happened prior to, just like I shared with you before with the flu day. When we took that flu day off, what we did then, we wouldn't do today. How we did. Now, some of the things we checked temperatures every day. I checked temperatures every day. I checked attendance every day to make sure we knew how many were actually sick from just being out. And we checked those rates. We're going to be doing that. That's going to be a new routine that our district office will do, and we're conscientious of those things. But again, going back to the online version, we are going to be offering online for those who are in medical need. When we have students who have needs through homebound services, we're going to be providing that the best we can, because we're not going to send a homebound teacher to somebody's home. We're going to be doing it best we can through the online services. But we know that that's going to be lacking because, again, I know that you said you have internet, and that's awesome. But only a third of our community, I'm talking about greater in the Chester County, has it. So you've got to have the least restrictive environment offered to all. And there's places where we can't offer an online option when there is no online there, even with the smart spot or the hotspot. I mean, I would love to say that, and I would, and tell you, if we had the internet service, this wouldn't even be a conversation. We would be offering it just out of the gate with others. But I've talked to the others who are making these offers to their folks. Ladies and gentlemen, they're no better off than we are. And I'm afraid that what's going to be realized by those families who have chosen that path, they're going to say, is this it? Because it's going to be nothing more than an electronic textbook left up to the parents to decide how to teach it. I don't know about all of them, but I suspect, because nobody in our West Tennessee area, outside of maybe Memphis, I don't know, Shelby County area, but none of us were prepared to start offering an online option. That's why in March, we just shut down. And we're working to get better, but like I mentioned about Southwest, that better is still years away. Some places it'll be improved, and if we can offer it more, we will. But right now, to make that commitment where we're offering it to as many or as much as we can, it is still too limited, not only with the availability, but also the ability of our teachers to deliver that content.
I have one question. So, are y'all allowing the same amount of students in the classroom that y'all did last year, or are y'all lessening? Like, how are they gonna be distanced?
Well,
Especially in East Chester, because they sit like 4 to a table.
well, they are, now, I will say this, I had a conversation yesterday with Kim, and they are changing. They're not doing the clusters. They're doing things different in the arrangement. Again, folks, as much as you guys are studying all this stuff, our teachers and our leaders are studying it too. And they're making some dramatic changes. I mean, again, to say that our teachers were going to start having lunch in the classroom, and like Dr. Johnson asked, having to be there when it's their duty-free time, they're willing to step up there and do that because they've already made those commitments in their heart that they want to do what's right for their children. But there will be efforts to improve. Again, social distancing is very difficult when you have a fixed room. The room counts as far as we've not hired new teachers other than what our needs are. But again, to do the social distancing that had been requested for 6 feet for every direction, that would cause us to have to purchase 3 more buses for every 1 bus that we currently have in the fleet. We don't have those monies. Or making rooms bigger. We don't have the means of creating a new building. So that's why we're asking our staff, we're asking our students in grades junior high and high school to help us out, to help mitigate the risk, and when they're within that 6 feet, they put a mask on. It's not going to fix it. It's a mitigation. It's not a fix, but it's the best we have for what we have.
So if they're junior high and high schoolers, they will still change classes?
Yes, ma'am.
They're still, okay.
Now, I don't know about the routine of exactly if they're going to kind of, if they're staggering it. I know that I talked to Dr. Anderson today, and there may be some staggers and starts between the grade levels. They may right, exactly. There's, and I had sat down and talked to Mr. Merlin, but I know that he and his staff have looked at these things. There's ways of doing things better. I think our students, well, I mean, we've all gone to Walmart or Dollar Store, and you see all the places where you see the 6 foot. I guarantee you most of us can pretty much measure by eyeball how far 6 feet is now. We're conscientious with those things. Our kids are not slow. They know it too. And again, I know that some of you have children who have reservations. I got an 8th grader who doesn't want to go to school either. So, and again, she'll feel that way next year if there's no mask in the world to be found. Because she just likes doing what she's doing, which is not much of anything. Yes, sir.
I've worked with my animals over 20 years. As far as this 10-minute exposure, that's absolutely false. Infection control. Let's say, for instance, I sneeze right here, and you're saying that they have to be around me 10 minutes to catch it? No, that's absolutely false. It's just like the flu, a stomach bug, anything else. It's on doorknobs, it's everywhere else. You can't sit here and say you have to be around somebody 10 minutes. That's absolutely false. Passing each other in the hallway at class change, in the bathroom, even in the classroom, that's full. It's more, you contract it like that, not 10 minutes.
Well, and again, I'm not a medical expert like yourself. I'm going on the ones who I talk to, Just yesterday.
And it's just common sense. I mean, you know you can get the flu just by talking to somebody who's got the flu. You know, it's airborne. So is COVID. COVID is a form of the flu. Okay, it's airborne. This young lady right here, just because I sit here 3 minutes beside her, does not mean she can't catch it from me. You know?
There's a lot of things right now that are uncertain, Mark.
Yeah, but you know, infection control is universal. And that's not 10, you can't sit here and say there's a 10-minute time limit. That's absolutely false, and that puts false hope and false information in the parents' heads.
We can only go with the best information we have at the time. And that's subject to change at any time. And if it changes, we'll modify that. We have to go with what's best for, based on what we know and when we know it.
I understand. I know y'all want the best for the kids, but it's common sense. You don't have to
I
have.
question some of the things that you bring up too.
I mean,
But it's coming from experts. The experts.
Yes, you're right, and the CDC and the WHO and Dr. Fauci says they don't recommend opening schools unless it's been 14 days in decline, and we're steadily increasing. You know, I don't understand. So we're going to pick and choose which policies and which things that we're going to choose to make it work in our advantage to get schools open. That's not right.
So is delaying it for 30 days not an option?
No.
Well, we're planning on starting school like we have, and I don't mean to be, sound negative, but, you know, kids need to be in school. I think a lot of them is the best place for them. A lot of them's home life is not the best, and being in school is probably where they're cared for the most. The other thing is, go down, let's see, last Thursday night, yes. And when you leave here, you can go down and see if there's not a whole crowd down at Dixie Youth. I'm sorry, but the kids are going to be around each other. They're going to be with their friends. I mean, this summer, do you think the kids have all stayed home and haven't been over to a friend's house there and there? I mean, I'm sorry, but we're going to plan on starting schools, like Mr. Kilger said, based on the information we've got. We're doing the best we can do for the kids, and, you know, that is where we're at. We are planning on going ahead and opening schools. Is that correct?
Henry, you got a question?
Oh, yeah, I'm Henry Brown. I'm one of the fleet of probably one of, say, 30 bus drivers that we have. And we're one of the major arteries for the kids getting to school, back and forth. If we go down, school has a tendency to slow down or stop. What, I know we're going to start school, but what I want to do, make a suggestion is, our bus drivers be equipped with masks for the kids that do want masks that don't have them. Okay.
Yeah, we're going to work on that, Henry. We are going to provide that.
Okay. My next question was.
But Henry, let me just stop and say this, just to make sure that people don't get confused. I said it before. We're not going to deny a child the access to get on the bus without a mask on.
Exactly.
I just want to make sure, because I am not going to defend anybody denying a child an education and get to school just because they're acting like a child.
Right, yeah, I understand
Yes.
this, but see, I have a 7-8 passenger bus. Any given time, I've got at least 60 students on that bus. Somebody's going to ask for a mask that wants one. I'm not going to say you have to have it to ride my bus. I'm not going to say that.
Yes.
But if they want one,
Yes, sir.
I want to have one to provide for them.
We'll make sure.
That's what I'm saying.
Yes, sir.
The next thing is, do we have a contingency plan for the drivers? Because if
When
something
you say
happens,
contingency plan, what's,
oh, well, what I mean is, we've got quite a few drivers in the school system that don't drive a bus, but they got the license.
okay.
Okay, see what I'm saying? They got license to drive. Now, say for instance, something happens to maybe 4 of us, get sick, we out for a legit reason as far as whatever's going on. We are down at least 2 buses now, 1 or 2, as far as drivers. We getting substitute drivers putting in there. Another 3 drivers go out sick for whatever reason. We've got drivers in the system that can drive, but a lot of them don't drive, school bus, for whatever reason. Sure. If they've got a license to drive, and we actually need them to drive, can we activate them to drive?
Well, when you say activate them, again, I will say this, Henry, I'm very appreciative that you went from a substitute driver to go back to a route driver. You do an excellent job. So I appreciate your...
I've done that 3 times.
I know. Hey, stop changing your mind and say what you do.
You need help.
So I know, and I greatly appreciate it, because you've always got the kids to and from school safety, and like you know, if you were there the other day when I talked.
Yes, sir.
My primary thing is to safe travel for all of our kids.
Exactly.
That's to and from home, to and from school. That is priority for a bus driver. But with what you said, there's some scenarios that are very difficult to answer because you're saying, what if 3 more? What if 4 more? You know, I know from my conversations in the past with Britt that we've had times where there have been multiple bus drivers out for sickness or some type of, say, doctor's appointment, and you know what they've had to do, and I trust Britt that he can come up with some type of plan to best either combine routes or adjust routes where people are having to take another short route, maybe that's one route normally, but they'll have to pick up a city route or a part of a city route. Those are ways that we can begin to address some of those things. The other expectation is there may be some families who don't necessarily want to put their kids on the bus. And I'm not going to require them to do so if they don't want to, if they don't feel comfortable with it, because it is. You can't knock out the walls of a bus.
That's right.
And we hope that the weather permits us when we have our routes that we can, because we need to, lower windows and allow ventilation to go through because that'll help. But every once in a while it gets cold, and every once in a while it's raining. In fact, sometimes it rains more than it doesn't.
That's right.
So in those cases, we're not asking the kids to get rained on and waterlogged. We're going to have to do things different. That's why it's, as I shared to the ma'am over here, we're strongly encouraging kids to wear the mask on the bus. And Henry, those kids will die for you. All you have to do is tell them. I know, and that's why they're that way. So I have no doubt that if Henry Brown says, I need you to put your mask on, they're going to respond to it. Now, I hope the other bus drivers have as an effective way of doing what you do every day, and I appreciate you.
Yeah, thank you, sir.
You're welcome.
Yeah, thank you. Appreciate y'all. I appreciate y'all listening tonight. Suggestions or comments. Thank you.
Yes. I've got a question for you, sir. We have to make the decision about starting back to school. What do you recommend?
That's why y'all on the school board, y'all make those decisions.
But that's why we're here.
I mean, no, honestly, y'all sit here and say it can't be delayed, can't give people the online option. So it sounds like we're 110% determined already, this is the way it's gonna be, no ifs, ands, or buts.
Let me back up just a second. We have to educate every student in the county.
You're exactly right.
We have to, but we want to also. We want to. So we can't pick and choose certain in the city that's got internet. Well, we're going to educate them, and the one out in the county, we're not going to educate them. That won't work. State and federal won't let us do that.
You're right, you shouldn't have to do that, but I know it's not everybody outside the city limits that does not have internet. I know there's Rabbit Ranch Road going out towards Jacksburg, there's internet out there. I mean, so there is some in the county that does have it. But the ones, I've got an autoimmune disorder, number 1. Number 2, my son does also. And he's going to be a freshman in high school. Y'all know 99% of the kids who have this stuff are asymptomatic. So, just because they ain't got a fever at school, don't mean they can't pass it on to somebody else and bring it home. You know, so talking about checking fevers and this and that does nothing. I mean, it's just going to prevent some, watching for symptoms, but 99% of the kids that have it are asymptomatic. So, I mean.
And Mark, like what Mark here said, we're doing the best we can with what information we have. We're not medically trained experts, so we have to rely on the information. And to be honest with you, I don't listen to Fauci all the time. I don't read and study everything that the CDC says. There's other entities on both sides of the aisle, whichever side people want to land on, that are pretty much saying the same thing, that the risk of what students are missing out with their education, being in that stay home, shelter at home status, is more detrimental than the risk for them coming to school. I'm telling you, I have talked to many of our teachers and leaders. I have seen the work that they've done and put forward to make sure that what we left school in March is not what we're going to be entering school in. Here it is in August. It's going to be a much more conscientious, more clean. Again, and I'll say this on behalf of the custodians, and I respect custodians. My grandparents were custodians at schools, so I have no better than you type of attitude. They do good work, they engage kids, just like Mr. Henry Brown. Sometimes they're the ones that talk to the kids more than the teachers.
Oh, totally agree.
So, but they do a great job. I know that our materials, cleaning materials and supplies we use are top of the line, hospital grade, and we're going to be very liberal with the use in the classrooms of routine practices to, again, wash hands frequently, to use hand sanitizer when hand washing is not as possible. We're going to have over 120 hand sanitizing stations set up in the schools. Not 120 each school, but 120 over the 6 schools. There's going to be more attention, more signage, more information, more attention to the teachers and the staff to make sure that they are very conscientious. But again, we're expecting everybody to really self-monitor. We're really leaning on our junior high and high school kids to help their parents by keeping them as much. Even though somebody may not want to brush your teeth, I got one of those too. Got to convince her to take a bath.
There's still parents who will send their kids to school knowing they're positive for COVID if they're asymptomatic because they don't have a babysitter.
Well, that's working off assumptions that we can't make decisions and plans around assumptions of what we expect.
Oh, it's not an assumption, it's fact. They do it with the flu. They do it with other diseases. They still send their kids to school because they have to work and have no babysitter.
But we can't control that. As a board, all we can do is try to educate.
I mean, I'm working with you.
We're not disagreeing with you, but all we can do is.
You can, but you can use common sense and don't say it takes 10 minutes to catch something.
I've seen something posted about desk shields. A teacher put up about a desk shield that we can purchase. A plastic one, but she said something about a paper one that she will provide. Is that something that's going to be given to all students, or?
Okay, now, and I've heard a little bit about this. Let me just start off by saying, I think that somebody needs to go back to the source of where that information started with, because it didn't start in Chester County.
But is that something that's going to be?
Here's what I learned. Another district, because of summer sports programs, where they were going against the routine that others were of offering contact sport practice, when the families kept wanting to have, and this is again, I'm going on what I was told. I may not be completely accurate, but this, when you said death shields, it reminded me of what I heard. It's not from Chester. There is no death shield. That's not from us. But it's where families were saying that we're going to take the risk of our kids being in these sporting situations that run the risk of being contagious.
I think you're misunderstanding your question. It's epilepsy.
Deaths. Okay. I've heard death shields too.
Death shield.
It's a divider between the kids. That was going to be my question.
Something like that, like when you went to alternative school.
Like this other thing, you might know what we're talking about. I'm sorry. Do you want to see a picture of it?
No. Let me just say that, I will say this, that there is going to be always something more to learn and study. We're going to do what's best for our kids.
Right.
If that means getting shields, then if that's something we need to invest in, we'll invest in it. But again, it's not going to be permanent fixtures. It would be something that moves, because, you've got only, anyway. But we don't have all knowledge of everything, but we'll make the best knowledge of what we, and best use of the knowledge that we do have.
Softball, baseball.
All right, I got a question.
On the teacher end, what are the guidelines for, you say quarantine for 14 days, if their symptoms are asymptomatic, they find out they have it. Are you making it mandatory that they be tested?
I would say
they leave school because they think they may have it.
Right.
Are they going to go home?
Well, again,
are they going to go to the doctor? Are you going to say, if you leave here, you need to be tested before you can come back?
Here is something that we have gotten guidance from everybody, and Thomas being here can help echo this. Any type of decisions with personnel if it goes like, say, or I keep on calling you doctor, if I say Mr. Murley has somebody say the same thing, I've got symptoms, my family, my son, my daughter, whatever was the situation, then Coach Merle is going to make a point to talk to Thomas. And that conversation is going to be from Thomas, so that we have consistency with all of our district staff, that the same message is said to all. Thomas is probably logged in no less than 40 hours worth of training from March till the present, from personnel matters, just like what we talked about with this critical infrastructure. The training that he's got over how to handle the employees will be consistent from him. With that being said, if you carry it further and they're stay home, the thing about it is that they're stay home and asymptomatic, they can still work from home. And that's in our policies now, Ben. We have a policy that we adopted back in April that reads about telework from home in case of emergencies or in case of disasters. So we have that in place. So somebody legitimately could offer services to their students still at home. That kind of begins to tie in with your options that you guys are asking for with virtual. Again, we're growing to that. It's not like we're turning a blind eye and a deaf ear to what you're requesting. I just know what our capacities are right now, and we're not where we need to be. We got the hardware, we just don't have the connectivity, and we don't have the personnel trained well to do it well. But we're getting there. We've got training that's going to be going on the next few weeks or days, and that training for professional development with online virtual learning will continue all year long. That's going to be a consistent plan.
The reason I ask that, I think our teachers, we have great teachers, and I think they literally want to be at the school.
Yes, sir.
I mean, you had 218, how many of them called me and said, I'm not coming back to teach this year because of kids dead? They want to be.
Right, correct.
And where I work in Southwest, we started out, we're essential workers, we have to be there, we have to keep the lights on. Now, in the beginning, it was 14 days. Now it's 5 if you test negative. You get a test, if you think you have symptoms, you think you may have it, you get tested. And roughly 3 to 5 days, if they call you and say you're negative, then you go back to work. You don't have to wait 14 days. Right. That's why I asked that question. If they wait 3 days and then go to the doctor, that lengthens the time that they're off. Because now you're 3 days plus 3 to 5 more. Right. If you make it mandatory that they would be tested day one, if they're negative, they can come right back to work.
Well, we have, and again, Thomas may be able to speak to it better, but I have not read anything yet for school personnel that gives us that. I know what you're saying about the essential, and that may be coming. Yeah. But I haven't seen anything that, now I know that they, and again, we would make sure that if somebody goes home confirmed, that whatever window their physician tells them, you need to be tested again, that they would be tested. They're not going to just show up at our door saying, I'm ready to come back. Yeah, they've got to have documentation to support that before they even walk in the door. And our teachers wouldn't run that risk. They're too conscientious and too professional to do that.
Yeah, there are some guidelines on that. If they do test positive, they're going to have to be out at least 10 days fever-free, for at least 3 more days from those original symptoms, So it's if you test positive, I mean, you're going to have to be out that time. If
so it is 14 days. 13 plus 3 days fever-free. Or 10 days plus 3 days fever-free.
Yeah, there you go. It's 10
so basically 14 days.
Yes, that's correct.
So you're not going to allow any teacher to come back in 3 to 5 days. It's going to have
if they test positive. Absolutely not.
Why? Based on the current guidelines that we're getting. That's, again, we've got to be safe, and they may, I know, and like what I said, it may change. Yeah. And we'll respond to it as it changes, either for our favor or to our detriment.
I think the test positive is a no-brainer for 14 days, but the person that has a family member that tests positive, but they may test negative, and you ask them to self-quarantine for 14 days, can that person come back with a negative test early? Because when we tell somebody to self-quarantine, it's 14 days. Yeah. If we have a teacher that has a family member sick, and then if they're negative, do they still have to self-quarantine for 14 days? Because that's going to be.
Based on what we did tonight, we declared ourselves
a critical infrastructure. They would have to have symptoms themselves.
Right.
Okay. Good. Because that could
That could be a detriment.
But to clarify, Ben, your question was, if the teacher tests negative, then they can return.
Yeah, I understand the 10 days if you test positive, but I don't think any of the teachers would do that, but I don't want you to have this documentation that the students' parents aren't aware of, and then they're unclear, and then you have 2 teachers test positive, or one goes home that you don't know if he's test positive or negative yet, and now you got 60 kids that don't want to come to school overnight.
Right.
So I think if they know the teacher is going to be tested, if they have symptoms.
That's protected information that we can't get into anymore.
Well, I'm not saying any confidential, deal, but laid out on black and white. If you have symptoms, then you should be tested. That way, negative, you come back in 3 to 5 days, or positive, you're going to stay home for 4 days.
Correct. I see what you're saying.
Correct.
That way, it gives them a little peace of mind. Because right now, they don't know. Well, was it a family member? And you can't, I know as a board, and you can't say, well, this teacher, and go into specifics. But you can say, they were running fever. We did ask them to go home, see a doctor, whatever. But in that, you can say, we made them be tested. That way, the parents know.
I think, and we may be able to, that's probably a question better suited for Thomas, but I don't think we can divulge any of that information. I think all that's protected.
But the CDC would notify those that we tested positive.
Exactly. The health department. Health department would be in contact.
I'm not saying release names of the ones that did.
Right.
I'm just saying that should be the policy, the guidelines. If any teacher, not specific teacher, had symptoms, that they be tested.
Right. Well, the first thing that they're told then is to, and again, following the guidelines, is to contact their physician. I'm hoping physicians do say those same things that you're saying, because it's got to be, like you said, the peace of mind of knowing I got it or don't. The majority of people don't catch it. Again, the majority of people in the state of Tennessee test negative when they're tested. The majority. And I know that's not everybody. That's why we have to still have these conversations and all wearing masks today. But it's still a majority of the people test negative. You can do whatever you want. You're boss.
All right, ladies and gentlemen, as we said, we're going to plan on school starting on time, and we're going to be as cautious as we can to take care of the children. That's our main goal. Now we're going to move on. We've got a couple of updates.
I do want to mention one thing, because I just want people to have peace of mind. And we have talked about our precautions. I fully think we're prepared. When we first made these decisions, the data totally supported it. It was based only on data, not personal feelings. But we cannot face the fact that the data has changed. So what I would suggest is we at least share there is a plan. We are sharing, we are opening. We're sharing why we're opening. We're sharing what we've done to prepare for opening. But we even mentioned tonight in one of our earlier conversations, what if there's an outbreak? What does that mean? And we can't talk general. We have 12 cases, no kids when we decided to open, total. Today we have 99, 26 have recovered. At what point do we have that conversation? I'm not saying we're ready for it, but I think the community would go more peace to know our mind is not made up just to go despite what happens, which I think is the false. There's nobody up here that doesn't care. I don't care what you read on Facebook. I don't care. Everybody cares, or we wouldn't be here. So we should care enough to say 26 today are recovered, 73 are not. Is that my math? Yeah. At what point do we say we need to look at our plan? And that, I think them knowing we have that in place gives them a peace of mind that we're looking at everything, if that makes sense.
Well, and I'll address that, Shane, with my conversation yesterday with Emily Rush, the head of the health department. She said, treat your county currently as a moderate to high risk for community spread. Right. Now, there's only 3 options: low, moderate, and high. She said from the moderate to high. So I would, and again, we shared cell phone numbers. We know we're going to talk a lot, but again, I trust that those who are in the work every day attention to that. The epidemiologist who I'm friends with and who I talked to back in the early March when our first case was positive. Those efforts, we've got people that are helping us support where we don't have to assume or try to play the role like we're the medical experts. That's when we lean upon those who are.
So the recommendation would come from the health department
Health
saying
Department.
it is time to go to option D.
Yes. Whatever
That's what, I just want people to understand, it bothers me when people say you don't want to list, or your mind's already made up. That is not true. We're listening to data. Data today, if the health department says it's okay, it's not just Troy Kilzer, it's not just the school board, it's a collective group of people saying it's okay, and we prepared the best we can.
Right.
But when those same people say, you know what, we need to look at this again, know that we're ready to look at it again.
Sure.
We're just not jumping off the deep end.
I agree. I think that, everybody's like, if they come back and say, hey, we need to look at this, or we need to consider this, then I think everybody's willing to.
Right, absolutely. And that's more for public to hear. I know we feel that way.
Right.
But I just want people to understand, our ears are open. And things change, it may change tomorrow. We may have 50 new cases tomorrow, and everything we've talked about tonight may change.
Right.
We don't know that though, but we're going with what we know today.
And I guess that was just more so of a concern that the climbing of cases is just steady climbing, it's not declining. And at this time to go back to school on August the 3rd, it's just, maybe we don't have such a high number of cases in children because they haven't been in contact with each other. But now you're gonna have all these children coming back in, and instead of upwards incline instead of a decline. That's why I understand the ask for the 14-day delay, the 30-day delay. I'm all for education. My kids have been educated ever since school has been out. I continue education during the summer. So I'm all about education for children. I believe in that, but at the same time, if I can have that wait for my children to not be in the incline, but rather wait on a decline, I think that would give us more peace of mind. But I do understand, school it must go on, I understand that. But it's the starting in the inclining cases.
Exactly.
It's just steady climbing. It's not going down.
Well, knowing that what Mr. Kilzer just stated, daily there's a conversation with that entity who are the experts.
Well, you said that.
That's not up to us, it's up to the health department.
Well, he said there will be no other shutdown. He said it will not be like it was before.
Each
I'm
individual
sorry.
school district.
I'm sorry. Listen, ladies and gentlemen, I appreciate you being here. I appreciate your concerns. I echo most of your concerns. I do. This is a public meeting. It's not a meeting of the public. You've got to let us get on with our business.
She'll have to address our concerns about our kids.
We spent an hour listening to your concerns. It's more than we've ever allowed for anyone. Well, you've got to let us get on with our business. Thank you.
It's up to y'all to do what you're gonna do.
Let's go on updates. I believe we all have a question about some of the updates.
Where are we at on finishing the baseball and softball facilities?
Well, and again, Fred asked if he needed to remind us, and I don't think I responded to him. He just got off his vacation. We've had, and this, I'm having to go back, because he had the conversation with Randall Gillespie back, gosh, that's probably been back in April. I'm thinking they're finished.
The bathrooms are not finished. There's no commodes or...
Well, I don't know if that was in the initial plans to finish out the bathrooms at this time. I don't think
They need
that's
to
the
be
case.
though, I mean, because if we don't, we're going to have some issues.
Okay.
I mean, they need to be finished. Much money as we spend on those facilities,
That's true.
they need to be finished.
Spent a lot of money. But I will follow up with Fred if he's available tomorrow, and we'll talk about the next steps.
Because I mean,
You know,
the girls...
There's not, what the baseball and softball programs wanted was not inclusive of even having that much. It was getting in the rough and getting them where they could have this in the future. And, you know, I want to be conscientious of the fact that what we've given them more than what they initially asked and requested, almost 5 times over. But I'll talk to you tomorrow.
I mean, with the investment we got, we need to go ahead and finish them. I mean, it's,
Does anybody else have anything, any other questions? All right, our next meeting will be on August the 20th, on a Thursday, and that will be here at the Board of Education.
we'll do the webinar next Friday, the 24th. The deal is going to cover what we've been done at the summer law. It's enough lunchtime.
I know that they canceled that at Jackson, but I
But
don't...
it's a webinar they're doing the
I haven't-
24th. It was on Tspa. Thomas ago.
You just stepped out that way.
But it's a Psba announcement. There's a webinar on the 24th at 11 o'clock, I believe. That you'll see summer law
Right.
updates.
They gonna give some language with it before that, so we can see what's gonna be actually, because
It just said cover what was normally covered in the summer law.